when the first IVF cycle fails, it's important to consider what kind of treatment we have undergone first. So in patients that didn't test the embryos, I mean if the patients that didn't do what we call the pre-implantation genetic screening, we should also know if they transfer good quality embryos first, and also if they were blastocyst embryos, I mean day 5 embryos. In the event that the patient transfer an euploid embryo, an euploid embryo means that the embryo has been previously tested and it's a healthy embryo. So we know that those embryos have a really high implantation rate, and because of that, sometimes we should consider doing some additional tests, such as endometrial test, uterine test, and some clotting and immune system tests. Of course, it's not the same transferring a low quality embryo that has not been tested than transferring an embryo with that had a really high chance of implantation. So in a patient that didn't undergo the pre-implantation genetic screening and with a low quality embryo, we know that the main reason why the embryo didn't implant could be the embryo itself. So it's not completely mandatory doing additional tests. However, if we are in the opposite kind of patients, the ones that did the testing of the embryos and had good quality and also healthy embryos to transfer, it's possible to add additional tests to try to guess if there are more factors that can also be affecting the implantation rate.